Let's take this matter forward as well as concerns about COVID infections here in Gauteng. I'm joined by the DA, Shadow MEC in Gauteng, Jack Bloom. Mr. Bloom, thank you so much for your time. We've heard the President saying again that while he is very concerned about this irregular Digital Vibes contract, he is going to wait for the SIU report to conclude. We know that the DA opened a case today. What is your party hoping to achieve by opening this case?
Well, I think it definitely deserves a criminal investigation, and really this is unacceptable. If you take the precedent set in Gauteng, in fact, where our health MEC, Bandile Masuku, was forced to step aside because there were similar type accusations against him. I don't know why the same rule is not being used with Health Minister Mkhize. It seems to me that if he was honour bound, he should just step down, firstly. But secondly, if you're going to be consistent with the case of Bandile Masuku as health MEC in Gauteng, he should be removed by President Cyril Ramaphosa. Look, I think everybody is really distressed that at a time when last year, when everybody was terrified of this virus and didn't know what to do and money was made available, some people, they only thought about themselves. They went there and they looted. They stole this money. And as a result, in Gauteng, we had substandard PPE. I think that cost lives. We had massive wasteful expenditure. We should have been spending that money more effectively on building extra beds to deal with the epidemic, and we didn't.
Yeah. And speaking of beds, I actually want to ask you about what you are observing, and this is not just in government hospitals in Gauteng, which I will get into in detail in a moment. We know that COVID infections in Gauteng are spiking quite alarmingly. We are a small, densely populated province. There's real concern that our third wave is going to be much worse than our second wave. And there was a disturbing tweet sent to me where someone said that they tried to get their father, who has COVID, into a private hospital in Gauteng, and 6 of the 7 hospitals they found, these are private hospitals, said we don't have the beds. What is going on in our hospitals in the province at the moment in terms of capacity, to your understanding?
Well, look, the latest official figures are just under 3,000 COVID-19 patients in hospitals. About 2/3 of that are actually private hospitals. I have to compare with the peak of that we had previously, where we had about 7,000 people in hospitals. So, in fact, we're at 3,000. We sort of barely have the capacity for 7,000. So hospitals are getting tight. They really are. In the public sector, I think are greatly concerned because a 1,000-bed hospital, the Shadow MEC at Johannesburg Hospital, is currently closed, including their critical ICU beds, which we need for this epidemic. So in terms of bed capacity, I think it's getting tighter, but it's not nearly as high yet as it was at previous peaks.
I have to ask for a comment from you. I interviewed Dr. Aslam Dasu last night. He raised a really big red flag. He said he is not seeing any signs of preparations at hospitals in Gauteng for these increased numbers. He's not seeing the extra wards, the extra beds, and he's really concerned about that. I don't want you to answer as a politician. I want you to answer as someone who I know monitors hospitals, looks around at the hospitals, because I think as a resident of Gauteng, I just want to know what we're dealing with, plain and straight. Have you been able to see any preparations? Do you think it's perhaps a little early for those preparations? Do you share Dr. Dasu's concerns?
I am actually very concerned. I think that the Gauteng Health Department has become a bit complacent here. I mean, I see crowded hospitals still, that in terms of social distancing, you have very vulnerable people. Helen Joseph Hospital, for instance, I was sent photographs of a very crowded waiting room. How can you do this? How can we have, crowded facilities where people can, God forbid, pick up the virus, people who are already ill? And that says to me we're not taking this terrible epidemic seriously enough. And I would hope that the authorities are preparing properly. That's what they said they have. But I'm afraid I have some misgivings, especially because of the existing overcrowding we're seeing in hospital facilities right now.
Yeah, and of course against the context of real worries about our hospital infrastructure. We know about the water crisis at Rahima Moosa Hospital in Coronationville. We know that Gift of the Givers has sunk a borehole. We know they've hit water, which is really great news. They're planning to do the same for Helen Joseph. But of course, where are the city officials in all of this? But I do want to play for you a chunk of an interview that my colleague Clement Manyatela did a little bit earlier. And he spoke to Sifiso Maseko, who is the Gauteng Health's head of health infrastructure, and he was asked about the problems at Rahima Moosa. Just take a listen.
Really having failed. I believe that the processes that have been put in place prior to that have managed to, in terms of the sustain and manage the healthcare system. It's just unfortunate that now we are just faced with the massive failures from supply from municipality and roadwater. And you are right that now we are aggressively looking at other safe measures like boreholes that it's able to then supply within that. But also boreholes, we also need to apply through the municipality. So we just ensure that we do not cause a problem through the intervention.
But do you accept this is something that you should have looked at a long time ago? You are looking now at the need for us to have boreholes. You need to apply it to the municipality. But you accept this should have been done a long time ago. You didn't need the Gift of the Givers to start this project in order to realize how important that aspect of backup is.
Yes, but even that same facility had boreholes that a sort of ran dry. So it's not that it's something that we thought of it, but it's something that was there. But I think we
there were boreholes.
To comfortability. Yes, there are facilities that have went within the boreholes, but then have sort of they will run dry after a time. But I agree with you that we probably found ourselves in a comfortability position, and we should have, as a mitigation strategy, just ensured that we just have enough in terms of that supply.
All right, so that's Gauteng Health's head of health infrastructure, Sifiso Maseko. A couple of points that I want to ask you specific questions on. He's saying that Rahima Moosa had boreholes. We know it had boreholes, but the Gift of the Givers told this program that those boreholes had not been maintained or they were not in use anymore. And the point there again is, where are the people who maintain the infrastructure? But right at the beginning of that clip, he says, we have not failed, and he's basically saying Rand Water has dropped the ball here. Is it possible to say who must answer for these shocking failures?
Well, look, I think Rand Water and Joburg Water have to answer for their failures. There's been a lack of maintenance there as well, and pre-planning, I think, and investment. But, you know, the Gauteng Health Department, as with the failure with fire security, you know, we've had, 4 fires at hospitals in the last 6 years, need to look at water security, and they should have prepared for this as well. It's really heartwarming, I have to say, that Gift of the Givers and many people of goodwill have arrived at hospitals donating water, but Gauteng Health Department should be buying extra water and getting in extra water trucks and digging new boreholes, but they should have maintained the old boreholes in the first place. So I think it's the same old story of lack of maintenance on infrastructure. That's why we have fires at hospitals now, we have water shortages, and at the end of the day, the people who suffer are the staff and the patients. It's really a very terrible situation that they're in the middle of an epidemic.
Thank you so much for your time this evening. That was the Democratic Alliance's Jack Bloom. Stay with us.